Hi, good afternoon, everyone. This is Hiju Park, a pharmacist and owner from Key Compounding Pharmacy. I'm very delighted to have Dr. Nina Walsh here today, and we're going to talk about another exciting subject that I'm very interested in learning, which is the stem cell therapy for your skin, holistic your skincare to
Right.
rejuvenate your skin. So before we get into that, I want to, introduce Dr. Nina Walsh a little bit more. She practices in Bellevue in Federal Way, and it's called the Flow Natural Medicine and Acupuncture. And so she has in-depth knowledge both in the Western medicine as well as the some Asian medicine, both in a naturopathic way. And so she has this innate, even your upbringing in your home in Russia where you were born, that you had a naturally has access even when you were young, using natural herbs and natural
Yes.
remedies to keep ourselves healthy.
Right. That was our background. That was my background growing up. Even though my mother was a surgeon, operating surgeon, she used natural remedies. For instance, propolis ointment for wound healing. And my father studied, actually, who was a microbiologist, he studied also effects of natural substances on tissue repair and regeneration, wound healing, immune system balancing and stimulating. So plants and natural remedies have always been part of my life ever since childhood.
Yeah.
And so I enjoy working with those as it applies to our health, in specific area. Aesthetics is of great interest to me. So I'm looking in depth into many different therapies that are appropriate and safe and effective for skin rejuvenation, for skin care.
Right. And in addition to that, because with the same philosophy and same principle, I know you're also passionate about the environmentally related some hardships or diseases that we all encounter, and then really keenly focusing on how to utilize natural substances to help those of us who are more affected by environmental challenges.
That is right. And that is much more relevant today, because 100 years ago, that may not have been an issue. And when people say, oh, my father, he didn't drink green juices all the time. He didn't take all these
Right.
supplements, and he was quite healthy. But they were living in a different world, and that is very unfortunate.
Yeah.
That time, the world was much cleaner. Many chemical substances, hundreds or even thousands of chemical artificial substances did not even exist at that time, whereas today the environment is really, really polluted with those. And so now we're feeling the effects, some of us, as you mentioned, more than others. And so detoxification and undoing those harmful effects is a very big issue. And sometimes we see conditions, we see syndromes or symptoms that don't fit in any traditional description, in any understanding or paradigm of an illness or disease that could be diagnosed. So now we see strange things. So understanding those, diagnosing those, and knowing how to deal with those is a new branch of medicine. It is called environmental medicine.
Right.
And of course, our skin is one of the first organs to show that level of toxicity or that pollution, the effect of the pollution on our body. So yes, we work with our body again, inside, internally, and outside, to be healthy on the inside and also look and be healthy and look youthful on the outside is the goal, especially with our female patients.
Right.
Although of course for everybody it's relevant.
So today's topic is about the stem cell, how to utilize the stem cell therapy a very natural and holistic way to rejuvenate in our the biggest organ of in our body, which is our skin, which also can be really naturally applied to even the environmental medicine and or some other areas. So I'm very excited to learn about your understanding about the stem cells, how we can utilize that effectively today. What is a stem cell
Yes.
therapy for your skin?
So stem cells are special cells in our body that have the ability to become any kind of cell. They're sort of dormant. And when stimulated, in the right environment or when there is a need, they can differentiate into any kind of tissue in the body. And so embryonic stem cells, for instance, when the fetus is growing, when the embryo is becoming a fetus and then eventually will become a human being, so everything comes from the stem cells, right? So because different tissues are being formed. In adults, we also have stem cells, and we have different areas of the body that are more rich in those, and we have stem cells that stem cells can become, when they divide, they become either stem cells again, or they become pluripotential cells, and then they differentiate. And so, depending on where they are in the tissue, they will become that tissue.
Appropriate for that environment.
Appropriate for that particular tissue. Exactly. Yes. And that is a key point. Now, stem cell research is a fascinating area in science. And it has been a big area of research for now the last, probably a couple of decades. And there's a lot of experience. There's a lot of clinical data in tissue engineering, in wound healing, in organ remodeling at this point. And even though there is still a lot to be done, but the potential is quite fascinating. And so we have seen results of tissue engineering in cancers, for instance, in bone cancer, in skin cancers, organ remodeling in heart valve, for instance, heart valve restoration, in wound repair, in burn victims, and so on.
Right.
So, and lately, the stem cells have received interest in aesthetic medicine as well. And of course, it's a much lighter application. So we're just dealing with, superficial layer of skin, basically for aesthetic purposes. But it is still appropriate because it is a safe and non-invasive treatment done correctly, and that can be utilized. Now we have the means to pretty much make it available to those who are interested in that particular approach.
So that our listeners understand a little easier, I understand that there is the stem cell therapy utilizing your own versus someone else's, or maybe from plant.
Yes, these are the different sources, so to speak. So someone else's, usually that means embryos, human embryos.
Which is more controversial.
And that is the controversial area, yes, because, there's several aspects associated with it, even though there's great potential, and for people who may not have another way of maybe saving their life, that is something that is very desired, but the regulation is not quite clear in that area. So that is
Still
controversial.
developing.
Exactly, that is still developing. So that's embryonic. And then you said your own, and we call it autologous. Autologous meaning from your own body. And so that is perfectly appropriate, that is perfectly ethical, and that is easily accessible because we have our body right here, right? And we have techniques that are safe, and they're pretty simple technology-wise to harvest those stem cells safely and also separate and concentrate them so that we can return them to the area of the body that needs repair, that needs healing, or that we need to stimulate rejuvenative process in, to activate kind of its own healing process. And so those stem cells come from different compartments, so to speak, in the body. And one is bone marrow. So that is a more invasive procedure. That can be used clinically, for much more invasive operations. However, for aesthetic use, and even for articular, for joint restoration, which is another wonderful, actually very, very successful area of application of stem cells. We use stem cells from the fat tissue in the body, and who wouldn't want to
Right.
get access and maybe get rid of a little bit of
Yes.
fat sometimes in the
To restore
in the wrong
your
area.
joints. Yes, that's a fascinating idea.
And that is actually a very, very effective way of doing it. So, and then the stem cells can be harvested from the blood as well, from just our blood, you know. And that is a very simple procedure. It's the same kind of a blood draw as when we do venipuncture, when we do blood work, blood test. And again, we just process the blood in such a way that plasma and the red blood cells separate, and that plasma is then activated so that we stimulate the stem cells. And then, and there are other compartments, and actually skin itself is a great source of stem cells. There are wonderful kind of depositories of stem cells, dormant stem cells around hair follicles. That's a very simple, very easily accessible and area, and very rich in stem cells. And so, so these we can utilize very easily for aesthetic applications.
Yes, yes. And then last podcasting, you showed us some commercial product that derived from plants, and then you can use it very, safely and effectively with utilizing the same principle, which is the growth factor from the plant for your skin.
So yes, and then so now we can talk a little bit about the mechanism of action of the stem cells. So why do we reintroduce them in the body? We harvest them from our blood or from the fat tissue, but then we apply them. And so why does it work? Because stem cells, when they're introduced into the environment that needs healing, they secrete enzymes and growth factors that activate this pathway, activate this process in the body. And that particular mechanism is very similar in plant stem cells as it is in mammalian or animal, which humans are also in that kingdom. And in that sense, we can use plant stem cells as well, because they sort of speak the same language. They can activate the same process, although it may not be as strong, in activation, but the idea is the same. The mechanism is the same. And what is very commonly used now as the plant stem cell source is an apple, apple tree, apple plant, or chlorella, for instance.
Yes.
So these have been used, and so that sounds quite appealing to me, but this is not your autologous source, right? And so the activity is limited. And of course, when these stem cells are manipulated in the lab and they're made into commercial product, then we're also dealing with some preservatives. There's only a certain concentration that can be used. It's not as powerful. It's not as profound an effect. Whereas, when we use autologous stem cells, it's very highly concentrated. Your own, signaling mechanism that stimulates process in your skin. So there is no risk of rejection. There is no risk of conflict because it's your own body.
Right. And also, I imagine when you apply to your skin, you want it to be in a certain way.
Correct.
Rather than just putting on top of your skin is not necessarily the best way to do it.
Right. I mean, it probably will do something. It will probably be effective in some way, but actually they combine therapies to increase the efficacy of this therapy. For instance, in any topical application, one of the issues that we have to deal with is the delivery, trying to make sure that the active ingredients that we're using get to that deep layer of skin where rejuvenation, where production of new cells like collagen and elastin is happening. So, and that is the very deep layer. It's called the basal layer and the dermal layer. So to get through the epidermis, through the very, very top layer of the skin, there are different means of delivery that are used. In creams, for instance, they use liposomal formulation, which I'm sure you're familiar as a pharmacist, because you have your own topical products that utilize that, and that's effective. So In the stem cell therapy in the clinic, in the aesthetic application, what we also use is actually mechanical device. We use sort of introduction of tiny micro punctures in the skin, in the top layer of the skin, and the penetration is about, it's very small, 0.4 to 2 millimeters deep, and that is enough to get to that deep dermal layer. And these are transient. So these little punctures are transient. So that means they will close momentarily.
Your skin
they will
will just close it.
exactly. The skin will close. However, if we apply that plasma with your precious stem cells that have been concentrated and activated, we can deliver those directly into that deep dermal layer where that new cells, new material is being created. And so that is a very efficient way. So in the clinic, we use a battery operated device, you know, that we can regulate the depth of the punctures. And but you can also use a very simple mechanical device, just like that you can buy, you know, these sure, these devices are available on the internet, and the important thing is that in this case you will have your own individual device at home, and you can buy it together with a cleansing solution to keep it sterile, to keep it clean, because after every application you want to cleanse it thoroughly and keep it safe, you know, and away from any contamination, so that next time you can use it and you will not introduce any infection. In the clinic, we also have individual attachments to our devices that we use just for that patient, and it's a single use. We don't reuse it, again, to prevent infection and to keep it completely sterile. So even if we use something like that by itself, you know, just by introducing those tiny punctures, that actually creates a micro trauma in the body, and that also stimulates the natural wound healing mechanism. Exactly. Yeah, production of that, you know, collagen and renewal of that area. And there is a way that we do that, for instance, and I also recommend that people use these in between treatments. So they come into our clinic for in-clinic treatment with plasma, stem cell rich plasma, or platelet rich plasma, we call it. And then at home, they can do maintenance actually a few times a week, just using this device gently. And they would do that just like this, you know, gently rolling it on the skin in 4 directions. Vertical, and then horizontal. And then also diagonal, in 2 opposite diagonal directions. And so at home, of course, you will not have your plasma, but you will continue to support that process that you initiated with the stem cell application.
So when someone you know, decide to go with this treatment, what's the typical duration, or how often do you do that at the clinic?
Right. So this is a very holistic treatment. That's why I also like it, because what we're doing, we're working with our skin natural mechanisms, you know, healing and rejuvenation mechanism. And that means we're restoring it 1 cell at a time. So it does take time. And it takes about 3 to 6 months to lay down new collagen fibers. And so collagen is what makes our skin taut, you know, collagen and elastin, and decreases appearance of wrinkles. And so we recommend 1 treatment per month, and for 5 to 6 months, 5 to 6 treatments. And after the 3rd or 4th treatment, you will see a big change if you do it regularly. And then if you also continue to maintain it at home, that makes it even more effective. But even without it, just those treatments in the clinic, they will start this process, and the process will keep going on, because now we actually have clinical studies. You know, there's a lot of research, stem cell research for various applications, a lot of in vitro, meaning in the lab, in the, you know,
yes, petri dish.
Dish, you know, but also in vivo on animals. And now we have clinical studies where we worked with human subjects, right? And we show very good results. Even, for instance, in one clinical study, they did treatments with PRP, with the stem cell platelet-rich plasma and the microneedling every 2 weeks, and for 6 treatments. And then they measured the results, and so after the end of the treatment, at the end of the treatment, that they saw remarkable improvement in tone of skin and improvement of collagen formation and density, and that effect persisted a year after the completion of the treatment. So it means that that natural mechanism is still working even months after. So, and of course, as a naturopath, I would like to say that if we're stimulating the renewal from the inside, we also want to make sure that we're supplying building blocks, that we're eating, food that contain good material for us to make healthy new tissues. And so those are antioxidants and vitamin C and collagen-rich foods. All those wonderful building blocks, good healthy protein, but fiber, so that your body is healthy on the inside, so that it can produce healthy skin cells on the outside as well.
And also, if you want to use your own blood, your plasma, as an autologous serum, the stem cell, you do want to have your blood to be healthy
and clean,
and nutritious,
rich in
and
nutrients and electrolytes. Exactly. Have a good protein status, have healthy cholesterol status, and no inflammation.
Right.
Yes, definitely.
Yes, that's great. And so, so again, we are going back to our original principles that we started in the beginning, from inside out approach, and you were really helping it from inside, your detoxification, the good food that you eat, your water, your sleeping well.
Absolutely.
And all those principles is applying it here again.
Yes, it is always our philosophy. It is always our guidelines. It is always something that we follow in taking care of ourselves. And skin is no different. And that's why I appreciate this particular treatment, because I incorporate everything. We talk about diet. And of course, within that course, 5 to 6 months, we can affect good changes in other areas of the person's health as well.
Yes, great. And so we've today I learned great things about the utilizing your own resources to make yourself beautiful. So I understand this perhaps not for everyone, not all the time, but there might be some listeners out there. It might be a good treatment for them. So
I think it is for everyone.
It is for everyone.
Actually, so if you at the age where you start being concerned about laxity, the skin drooping and the wrinkles forming, that is a very simple, very natural, very easy way to do, and then just keep maintaining. And again, different people choose different things, but I think, except for like really young people who look completely beautiful and wrinkle-free.
That's what I mean. It's not for everyone.
Yes,
if you already have.
Right. But otherwise, I'm really fond of this treatment, and I have seen really good results and really no side effects. Just maybe mild puffiness and mild redness that goes away within 24 hours, and otherwise, pretty much that's it.
I really love the concept of utilizing your own potentials and your own resources to empower you even more. So that's very fascinating.
It's the same approach.
Same approach, yes. All right. Well, thank you so much for listening. We will come back with another exciting topic next time. Until then, please have a great day.
Thank you.
Thank you, Dr. Walsh.